Welcome back to The Explainer. You know, we take about 20,000 breaths every single day. And honestly, we do it mostly without even thinking about it. But what happens when that automatic, absolutely vital function falters? Well, today, we're diving into the incredible hero's journey of respiratory care. We're going to discover exactly how humanity learned to understand and eventually control the breath of life to save lives. Okay, let's dive into our roadmap for today. We're going to start with the origins of breath, then move right into the technological revolution. From there, we'll explore the rise of the respiratory therapist, and finally, look at educating the next generation. Before we jump back in time, let's firmly establish who our modern heroes actually are. A respiratory therapist, or RT, isn't just someone who hooks up an oxygen tank. Not even close. These are specialized healthcare professionals who apply rigorous scientific principles to prevent, identify, and treat acute or chronic cardiopulmonary dysfunction. Basically, they are the ultimate stewards of our cardiopulmonary health. All right, Chapter 1. The origins of breath, from ancient humors to the scientific revolution. Now, what's really fascinating about this timeline is just how early the ancients knew that air was absolutely vital, even if they couldn't really explain why. I mean, there's evidence that tracheotomies to relieve airway obstruction were potentially performed all the way back in 1500 BC. But for centuries, the actual mechanics of breathing were a total mystery. Hippocrates blamed diseases on humoral disorders, imbalances of things like phlegm and yellow bile. Fast forward a bit to Galen in the 2nd century AD, and he theorizes that inspired air contains this mystical vital substance that charges the blood. So they were kind of on the right track, but completely missing the hard science. The real game changer, though, that arrived with the Renaissance and the scientific revolution. Humanity finally shifted away from ancient mysticism and started looking at measurable physics. As a general rule of thumb, modern respiratory care traces its true roots to 1662. That's when Robert Boyle published Boyle's Law. He proved that for a given mass at a constant temperature, a gas's pressure times its volume is constant. This was literally monumental. It meant the invisible air around us behaved according to strict, predictable physical laws. And that momentum? It built into this explosive period of rapid-fire discovery in the 18th century that completely transformed our understanding of human physiology. In 1754, Black describes carbon dioxide. Then, in 1774, Joseph Priestley describes oxygen, although, fun fact, he actually called it dephlogisticated air. But the real puzzle pieces snapped together between 1775 and 1794, when Lavoisier finally demonstrated the actual process of gas exchange in the human body, showing that oxygen is absorbed by the lungs and carbon dioxide is exhaled. Which brings us to Chapter 2, the technological revolution, machinery for survival. Check out the BLB mask, named after its inventors Boothby, Lovelace, and Bulbulian. This was introduced during World War II, originally to give high-level oxygen to military pilots flying at insane altitudes. It perfectly illustrates how the intense necessity of wartime aviation birthed equipment that would later be directly adapted for clinical oxygen therapy on hospital patients in the 1950s and 60s. And honestly, this evolution of technology is just jaw-dropping. Just look at the contrast here. We started with mid-1800s negative pressure ventilators, which were basically these clunky wooden boxes designed to mimic the vacuum effect of the human chest. Compare that to the highly sophisticated, microprocessor-controlled positive pressure ventilators of the 21st century. We've literally gone from simple mechanical bellows to digital life support systems that adapt to a patient's breathing millisecond by millisecond. But with great technology comes serious risks, right? Traditional short-term mechanical ventilation is highly invasive because it requires an endotracheal tube. While it absolutely saves lives, it carries the potentially deadly risk of VAP, or ventilator-associated pneumonia, which happens when microorganisms enter the airway. Because of that major risk, modern medical science is constantly pushing to use non-invasive ventilation whenever possible. By using specialized masks or high-flow nasal cannulas, we can support breathing while completely avoiding intubation and dodging those severe VAP risks. Moving on to Chapter 3, Rise of the Respiratory Therapist, Birth of a Profession? As all these machines became incredibly complex, hospitals quickly realized they desperately needed a new kind of dedicated hero to run them. Back in the 1940s, the first specialists were simply called oxygen technicians, and their job was mostly just hauling heavy cylinders around the hospital wards. But in the 1950s and 60s, they leveled up into inhalation therapists, getting trained in positive pressure breathing and aerosol meds. Finally, in 1974, the official respiratory therapist designation was born, standardizing the role into the highly skilled allied health profession we know today. So the crucial point to take away here is that this is absolutely no longer a niche field. According to 2021 data, there are over 135,600 practicing RTs in the United States today. They are in acute care hospitals, clinics, diagnostic labs, you name it, serving as the absolute backbone of our cardiopulmonary care. And that number, it is climbing fast. The expected job growth for respiratory therapists between 2021 and 2031 is a massive 14%. And why does that matter? Well, because the real-world stakes are so incredibly high right now. Between an aging population and a steady increase in chronic respiratory diseases worldwide, the demand for these experts is quite literally greater than ever before. Now, building a highly respected medical profession requires serious structure. Welcome to the alphabet soup of respiratory care. You've got the AARC handling professional advocacy. The NBRC is the strict testing body that ensures every RT is heavily credentialed and competent. CoARC makes sure educational programs are up to standard, and the ARCF acts as the charitable arm funding vital research. Together, this web of organizations elevated the RT from someone just pushing oxygen tanks into a deeply respected medical expert. All right, moving to our final section, Chapter 4, Educating the Next Generation, from technicians to physician extenders. Because today's therapists, they're intense practitioners of evidence-based medicine. They don't just push buttons. They're deeply involved in disease management through therapist-driven protocols. That means they are physically assessing the patient and modifying care plans on the fly. While an associate degree is the baseline, the whole field is trending hard toward bachelor's and master's degrees. With these advanced skills, the modern RT operates essentially as a highly consultative physician extender, right there at the bedside. So, as a general rule of thumb for any future students out there, aim high. As this profession continues to expand, jobs in management, education, research, or advanced clinical practice normally require bachelor's or graduate level education. The field is actively calling for more leadership and pushing the academic boundaries of the profession. I want to leave you with this final kind of provocative thought. We've seen ventilators go from literal wooden boxes to digital marvels. But as respiratory technology becomes more autonomous and automated, how will the role of the human respiratory therapist continue to evolve? Artificial intelligence can certainly monitor a screen, sure, but it takes a trained, compassionate human to truly assess a struggling patient and hold their hand through a terrifying crisis. Thank you so much for joining me on this explainer today. Next time you walk through a hospital, remember the history we just uncovered and definitely respect the vital stewards of breath who keep us all alive. See you next time.